industries work. But here in Nigeria, it's difficult to actually sell our program to stations.
You can't let one thing suffer for the other.
Hello and welcome. You're on to the show, Chat to the Professional, the show that has been designed to x-ray the activities of professional individuals and corporate bodies. As always, I remain Martin Sobu, and I'm sure glad to be with you. Today, we are discussing health. Over the years, we've so much complained about the decay in the infrastructural and human development in the health sector, which has led to serious brain drain in the industry. It's not only the health industry or the health sector that has been affected by this, but health is a critical issue. And then you and I know that a lot of money, millions and millions of dollars, are wasted every year by Nigerians traveling abroad to seek medical attention. And today we are going to be having the chief public servant in the sector, talking about the Honorable Minister of Health, Professor Chukwu. He will be our guest on our show today. Please don't go away. The special guest segment returns after this break. We'll be back. You're welcome back. You're still watching the show, Chat to the Professional, the show that has been designed to x-ray the activities of professional individuals and corporate bodies. Like I mentioned to you in my introduction, today we are having on the show the Honorable Minister of Health, Federal Republic of Nigeria, in the person of Professor C.O. Onyebuchi Chukwu. He will be talking to us today about the activities of this ministry, and we shall, at the end of the day, be narrowing it down to specifics, talking about international funding as it affects his ministry. So join me now as I welcome Professor Chukwu. You're welcome to the show.
Yeah, thank you.
All right. Since your assumption as the Minister of Health, Federal Republic of Nigeria, what would you say are the challenges you faced?
Well, the first challenge I would say actually is that there's a relative lack of reliable data.
Okay.
Particularly with respect to prevalence of disease.
Okay.
Prevalence of the problems generally. So that is one. Then, of course, the second one is funding. Funding is never enough. That is a challenge. Then the third one is that in some aspects, we've not had any particular system, what you can call a system that is functioning. Okay. And so whatever you decide to do at any particular point along the track may not really work because it's not in the form of a system. Then, of course, the other challenge is that we came at a time, as new ministers. I was one of the new ministers appointed some months ago, about 6 months ago. And we came at a time that the country was also preparing for elections. As you know, there will be elections in 2011, general elections. Okay. And that, of course, also meant that you didn't have all the time you needed. Mm-hmm. So there is that pressure. So these are some of the challenges, I would say.
Okay. You know, the exciting thing about your appointment as a minister is that before coming on board, you've been a chief medical director.
True.
And that presupposes that you already are in the know about the challenges faced at the primary and the tertiary level of health provision in the country. Yeah. Be that as it may, I still would like to know, now as a minister, have you enjoyed good support from both government and the people of this country?
From the federal government, of course, I enjoy full support of my principal, Mr. President, and other colleagues. Health is one ministry, but we relate so much with other ministries. I think I've enjoyed a good relationship with my colleagues, those with me on the Federal Executive Council. With the states, yes, to a large extent. I've had cause to address the Nigerian Governors Forum. Okay. I was invited by them. I spoke to them. They seemed to be comfortable with some of the ideas I was bringing in. At individual levels, I've met a number of governors who seemed quite enthusiastic and, with working with me and my ministry. I haven't had much contact with local government chairmen, but through their organization, the Argon, I've maintained some contact, and I would say they seem willing to cooperate with me. For the people, it's difficult to judge. That is for them to actually say whether they are willing. But I think what is important from the much I know about my compatriots, the Nigerians, and Nigerians will always work with anyone they feel really means well. If you begin to show that commitment, that openness, that willingness to go the extra mile, Nigerians are quite patriotic. And from interactions I've had with groups, the unions, professional groups, and even people on the streets, I wouldn't know whether they're just saying it for saying so, but the impression I get is that so far they think I should be the kind of person that should win their confidence, and I'm making an effort to show that we can begin to do what we say. Okay. And I think that is what it's for them ultimately to judge. Yeah. Thank you.
All right, having said that, you've enjoyed tremendous support from the federal government. Yeah. How about your colleagues? The issue of incessant strikes, by the medical doctors, it's becoming an embarrassment to the nation. In other climes, for instance, if you go to the United States, the health sector, I make bold to say, is largely sustained by Nigerian medical experts. So how come back home we're having these challenges? And are you in touch with them? Do you think the challenges we are facing are insurmountable?
I don't think there's any doctor working for the federal government who is still on strike at this moment. Okay. When I came in, they were on strike before I became minister. Okay. The resident doctors, a section of the resident doctors were on strike. Incidentally, on the day I was inaugurated by Mr. President, the Honorable Minister of State for Health, who had actually assumed duty before me, had actually engaged them in dialogue. And it was on that morning, as I was being inaugurated, that particular group of resident doctors actually called off their own strike. And to the best of my knowledge, that particular group of residents have not been on strike again. Now, there was another group that threatened. As I came in, I met the letters on the table of the minister. I inherited those letters, and we began to make contact with them. They had long threatened that they were going to also embark on a strike. One wasn't too sure what was the problem, but I think what we felt was that based on previous experience in the past, people have become quite cynical. And based on that cynicism, they were not willing to listen. But I think now they've seen the direction in which we are going now. Many of them informally have sent to us across informally to say, sir, we have every reason to believe you, because whatever I told them we're going to do, whatever were the reasons for prisoner on strike, and whatever we told them government was already doing, government was going to do, we've accomplished all of them 100%, and I thank God for that. So again, that was that's what I told them at the beginning, that you don't need to judge people continuously from the past. Yeah. The past is important, but if you continue to live in the past, then you cannot make progress. And I'm not giving to making promises. Even if you want me to make play to the gallery, I'm not too good at that. Maybe that's one of my weaknesses. But whatever I commit myself, I'm not God, but the idea is that God will support what is good. And I thank God so far that whatever I had promised my colleagues, you said, my doctor, and even indeed all health workers, because I'm not minister for doctors alone. Yeah. I'm minister of health. But it's just that the others kind of believed me, and it was ironical that a section of those who should ordinarily believe the minister being, but I think it's all history now. There's nobody who is on strike in the federal health system right now.
Okay. Thank you very much. Viewers, you must agree with me that we have here a court professional manning a very important ministry in the Federal Republic of Nigeria, in the person of Professor Chukwu, as the health minister, talking less and doing more. At this point, we must take a break. Please don't go away. We'll be back. You're welcome back. You're still watching A Chat with the Professional, and my guest remains the Minister of Health, Federal Republic of Nigeria, Professor Chukwu. Before we went on break, you've tried to give us an insight into what you've done since you became minister, and you made one important point, that you had no data. You had almost nothing to work with. And I've listened to you speak at a public forum. I think that was at the World Cancer Day. And I heard you mention something like not just making promises or not just talking, but acting. And I'm glad you're doing so. So I'm drawing inference from that to ask what effort your office is making to ensure modernization of facilities, both for primary and tertiary health provision in this country.
Okay. Thank you. Just permit me before I answer this, just a little clarification. I didn't say there was no data.
Okay.
There's always been data. What I just said is that we could do with more reliable data, more population-based data. The last population-based data we're working with is fair enough, and that is the National Health and Demographic Survey data of 2008. But that didn't cover everything, and of course it requires to be updated. So what we're talking is reliability of data, not that we didn't have data at all. We did, but it's just reliability. Then coming back now to your question on what we could do to modernize our health system, as it were. Let me just make one basic statement. No matter what we do, if we do not get primary health care right, we'll go nowhere. So primary health care, as has been recognized over several years now, must remain the bedrock of healthcare in any country. And Nigeria is no exception. So one is going to work hard on that and then move up to the tertiary level. Now, we need to have a system. Earlier on, I said one of the challenges is having a system. We need to have a system, a national system, a national health system. Granted that we have a revised national health policy. Granted that before I came on board, the National Council had adopted what my predecessor did in office in terms of championing what we now call the National Strategic Health Development Plan, which is actually taken from our overall vision, the Vision 2020 of the federal government. We actually need some kind of document that will show the general direction in which we are going. And that is where the National Health Bill comes in.